Good day everyone. So for today's topic, we're going to tackle about Trichinella spiralis. It is a nematode. What is Trichinella spiralis? Trichinellosis, also called trichinosis, results from roundworms or nematodes from the genus Trichinella. Trichinella is the smallest known nematode parasite of humans. The male measure is about 1.4 mm to 1.6 mm in length, and the females are twice the size of the males. The body of the worm is more slender at the anterior than at the posterior end. In females, the uterus is contained in the posterior portion of the worm and is filled with developing eggs. The anterior end of the female contains hatching juveniles. Next is mo ni siya ang picture sa Trichinella spiralis in the left side, and in the right side is na-insist na siya sa muscle sa isa ka tawo. Where did Trichinella found? It possesses the capability of infecting a wide range of mammals including pigs, horses, reptiles, and birds, but it causes disease only in humans. By eating improperly cooked or raw pork, horse or other domestic animal meat, and wild game meat like bear meat, humans acquire the infection. Some reports have mentioned an occasional acquisition of the disease by ingestion of reptile meat, including lizards and turtles. There are no reports of human-to-human transmission. Trichinosis is caused by the larvae of Trichinella roundworm. The parasitic worm is often found in animals that eat meat. Pigs are one of the most common carriers of this parasite. The Trichinella roundworm is also commonly found in bears, foxes, and wild boars. Animals can become infected with Trichinella when they feed on other infected animals or on garbage containing infected meat scraps. Humans can contract trichinosis when they eat raw or undercooked meat of an animal infected with Trichinella larvae. After the parasites are ingested, the acid in the stomach dissolves the cyst, which is the protective capsule surrounding the larvae. When the hard covering of the cyst is dissolved, the larvae enter the intestine, where they mature into adult worms and reproduce. The female worm then release their larvae into the bloodstream, allowing them to migrate through the blood vessels into the muscles. Once they are in the muscles, the worm encapsulate into muscle tissues, where they can live for an extended period. The first symptoms of trichinellosis are gastrointestinal, usually occurring 1 to 2 days after a person consumes raw or undercooked meat from a Trichinella-infected animal. The symptoms include nausea, diarrhea, vomiting, and abdominal pain. While the following classic symptoms of trichinellosis often occur within 2 weeks after eating contaminated meat and can last up to 8 weeks includes muscle pain, fever, swelling of the face, particularly the eyes, weakness or fatigue, headache, chills, itchy skin or rash, cough, diarrhea, and constipation. Symptoms may range from very mild to severe and relate to the number of infectious worms consumed in the meat. Many mild cases of trichinellosis are never specifically diagnosed because They are assumed to be the flu or other common illnesses. Furthermore, many people with trichinosis do not experience any symptoms at all. If the infection is heavy, persons may have trouble coordinating movements and have heart and breathing problems. Although rare, that can occur in severe cases. For mild to moderate infections, most symptoms go away within a few months. In this picture, you can see the life cycle of the Trichinella spiralis. So, adult worms and encysted larvae develop within a single vertebrate host, and an infected animal serves as a definite host and potential intermediate host. A second host is required to perpetuate the life cycle of Trichinella. The domestic cycle most often involved pigs and anthropophilic rodents, but other domestic animals such as horses can be involved. In the sylvatic cycle, the range of infected animals is great, but animals most often associated as sources of human infection are bear, moose, and wild boar. Trichinellosis is caused by the ingestion of undercooked meat containing encysted larvae of Trichinella species. So, in number 1, the ingestion of undercooked meat, after exposure to gastric acid and pepsin, the larvae are released from cyst. In number 2, larvae released in small intestine and invade the small bowel mucosa where they develop into adult worms. Number 3, adults in small intestine. Females are 2.2 millimeter in length, males is about 1.2 millimeters. The lifespan in the small bowel is about 4 weeks. After 1 week, the females release larvae. In 4, larvae deposited in mucosa that migrate to striated muscles where they insist, and in 5 encysted larvae in striated muscle. Diagnosis is usually made based on clinical symptoms and is confirmed by serology or identification of encysted or non-encysted larvae in biopsy or autopsy specimens. Next is the diagnosis. A diagnosis of trichinosis is made in patients whose signs and symptoms are compatible with trichinosis, have a positive laboratory test for Trichinella, and who can recall eating raw or undercooked pork or wild game meat. In laboratory, diagnosis of trichinosis is most often made by Trichinella antibody test. In some cases, a muscle biopsy may be performed. As you can see in the picture, this is the bear muscle showing the encysted larvae at 200x magnification. Next is the possible treatment for trichinosis. Safe and effective prescription drugs are available to treat both trichinosis and the symptoms that occur as a result of Trichinella infection. Treatment should begin as soon as possible. A doctor will make the decision to treat based upon symptoms, exposure to raw or undercooked meat, and laboratory test results. In addition, the best way to prevent trichinosis is to cook meat to safe temperatures. A food thermometer should be used to measure the internal temperature of cooked meat, and you can also prevent it by washing your hands with warm water and soap after handling raw meat. Freeze pork less than 6 inches thick for 20 days at 5 degrees Fahrenheit to kill any worms. Freezing wild game meats, unlike freezing pork products, may not effectively kill all worms because some worm species that infect wild game animals are freeze-resistant, and clean meat renders thoroughly after each use. To help prevent Trichinella infection in animal populations, do not allow pigs or wild animals to eat uncooked meat, scraps, or carcasses of any animals, including rats, which may be infected with Trichinella. That is the end of my topic, and thank you for watching and listening. Hope you learned something about the topic and the nematode Trichinella spiralis. Thank you and God bless everyone.